My name is Rosie Hill and I'm one of the Macmillan Specialist Dieticians here at University Hospital, Coventry in Warwickshire. As part of the Living With and Beyond Cancer sessions, today I'm going to be talking about diet and nutrition. In today's session, we're going to be looking at the evidence base for healthy eating guidance for people living with and beyond cancer, the link between body weight and cancer, healthy weight management and reducing the risk of cancer recurrence and other long-term health conditions, cancer dietary myths, and practical tips for you to put into place. So before we start, I think it's important to acknowledge some of the long-term consequences of cancer and its treatment, particularly relating to nutrition. And this can range from diarrhea to constipation, swallowing problems, pain on eating, sore mouth or loss of appetite. And these can affect how much you're able to eat and whether you're able to maintain your healthy body weight. These can be long-lasting or very short-term, and it's important to speak with your dietitian, clinical nurse specialist or consultant if these are affecting your quality of life. So healthy lifestyle, what's the evidence? There's now good evidence that eating well and maintaining a healthy weight during and after cancer can help to improve overall health and sense of well-being, boost immunity and your ability to fight infection, reduce some of the side effects of treatment, improve energy levels and fatigue, speed up your recovery after treatment, and reduce the risk of your cancer coming back and prevent other long-term health conditions such as heart disease, the risk of having a stroke, or type 2 diabetes, amongst other things. So Cancer Research UK identifies that up to 6 types of cancer are directly affected or can be affected by the food that you eat. And we know that patients who have a low fibre intake, a high calorie intake, and are of a higher body mass index are at higher risk of developing cancers such as bowel cancer, mouth and upper throat cancer, and esophageal cancer. As a result, the World Cancer Research Fund recommends 10 cancer prevention steps. And these link with the Macmillan and British Dietetic Association top 10 tips for eating well. So it's important to keep a healthy weight, and we'll come on to that in a moment. Eating regular meals helps maintain your blood sugar levels and prevents you potentially needing to snack on higher calorie and higher fat foods. Resting less and moving more, and aiming to be physically active every day. Eating more plant-based diet, so having a variety of fruits and vegetables, choosing whole grains and pulses such as beans, which are high in fibre, release energy slowly, contain antioxidants and are low in calories. Avoiding sugary drinks and limiting processed foods such as cakes and biscuits. And limiting your red meat intake, such as beef, pork and lamb, to 3 portions a week, as well as avoiding processed meats because of their nitrate content. And this includes foods like salamis, frankfurters or bacon. Having a balance of dietary fat and cutting down on your saturated fat, for example lard, and limiting your salt and foods processed with salt because of their high sodium content. And knowing your limits, so if you do drink alcohol, limiting this to 14 units per week, spread over the week, with having some alcohol-free days during that time. And not needing to use dietary supplements to protect against cancer. We know that being overweight can cause 13 types of cancer, and these include esophageal, breast, kidney, bowel, and womb cancer. But what's the link? Well, researchers believe it's maybe linked to the balance of hormones in the body. Fat cells release hormones that can increase your cancer risk. And storing too much fat can lead to insulin resistance, which can encourage the body to produce growth hormones, which are also linked to that cancer risk. Body fat stimulates a general inflammatory response, which may contribute to the development of several cancers. And although this isn't solely based on your body weight, it may have a big impact. And things like genetics and your history may also impact that risk. Hopefully you've all heard of body mass index, and this is the ratio between your weight and your height. For the healthy population, we're looking at a body mass index, or BMI, of 18.5 to 25 kilograms per metre squared, which in this chart is shown as the yellow section. When we're talking about weight and weight management, it's important to talk about energy balance. Energy balance is how we look at the energy in versus the energy out. So energy in is the calories that you eat, and energy out is looking at the activity that you use to burn those calories. In order to maintain your body weight, it's important that your energy in matches your energy out. In order to lose weight, we need a deficit of about 500 to 600 calories per day. So you need to be burning or eating less than 500 to 600 calories a day in order to lose half to 1 kilo or 1 to 2 pounds per week for healthy weight loss. On the other hand, if you eat an extra 100 calories every day, over the year you will increase your weight by 5 kilos or 11 pounds. This is the Eat Well guide, and it shows an overall idea of what your balanced, healthy diet should look like. So when we look at the Eat Well guide, we can see that the two largest sections are fruits and vegetables and starchy carbohydrates. We're aiming for more than 5 portions of fruits and vegetables every day. And this can be dried, frozen, tinned, fresh or cooked fruits or vegetables. And it's important to aim for a variety of colours to make sure you're getting in all those vitamins and minerals. An ideal portion size to remember is that of your hand, so that gives you an easy way to remember what a portion size of fruit and vegetables is. In the yellow section, you've got the starchy carbohydrates, and these are the energy sources of food in your diet. They're the most easily broken down source of energy for your body. And this includes things like potatoes, pasta and rice. When looking at these foods or choosing these foods, going for whole grain or brown versions, because these will slow the release of energy down rather than the white sources which release energy much faster. Then in the pink section, we've got the protein sources. And it's important to try and have a more plant-based versions of these, such as beans and pulses, and having 2 portions of fish per week, one of which is an oily fish. When having red meat, looking for the lean options, and as I said earlier, only aiming to have these 3 times a week. You then have your dairy and your dairy alternatives, and if you're looking to lose weight, choosing the lower fat options of these. These are important in our diet for bone health because of their calcium content. We then have the smallest section, which is those oils and spreads, and ideally using unsaturated oils and using in small amounts, so using olive oil and rapeseed oil rather than butter or lard. We also want to aim to eat less portions and less frequency of foods very high in calories, such as biscuits, crisps and cakes, because they're very high in calories and can lead to that weight gain over time. In order to keep hydrated, it's important to have 6 to 8 glasses of fluid per day, but this doesn't have to just be water. It can be a sugar-free squash, a small portion of fruit juice, or tea and coffee. That all counts. Physical activity is also really important when we're thinking about energy balance. The UK Chief Medical Officer's guidelines recommend that we do a combination of at least 150 minutes of moderate intensity activity with 75 minutes of vigorous activity or a mixture of both. It's also important to do strengthening activities on 2 days a week. And this could be lifting weights, carrying shopping, or doing your cleaning around the house. Anything that's going to be building that muscle strength. It's important to also try and improve your balance, and doing things like yoga or Tai Chi 2 days a week to try and improve your balance and prevent falls in the future. The main thing is to reduce your extended periods of sitting down, so keeping active and walking regularly to try and improve the activity that you're able to do. This is important because we know it benefits your health, reduces your risk of type 2 diabetes, cardiovascular disease, falls, joint or back pain, and can prevent some cancers. Physical activity can also improve your sleep, help you maintain a healthy weight, manage your stress, and improve your quality of life. But remember, whatever you're able to do, some activity is better than nothing, and it's never too late to start. So, key practical messages: limit your intake of fatty and very sugary foods, keep an eye on your portion sizes, be more active every day, and if you're looking to lose weight, aiming for a 500 to 600 calorie daily deficit to achieve healthy weight loss. So when we talk about diet and cancer, or if you put it into the internet, you get millions of responses, and it can be very difficult to know what to believe. There are lots of popular anti-cancer diets out there. Unfortunately, there's no evidence behind any of these diets that they will reduce your risk of cancer recurrence. And actually, they can be very limiting. For example, a vegan diet would need lots of planning to make sure you're getting adequate protein sources and also meeting your vitamin and mineral intake. They can also cut out whole food groups, such as the paleo or the ketogenic diet. They can also be very expensive, for example, following an organic or gluten-free diet, where you'd need to be buying more costly food products. So to conclude, the take-home messages from today's session: to increase your plant-based food, so increasing your intake of fruits, vegetables, and high-fibre choices, limiting red meat to 3 times a week, and avoiding those processed meats such as salamis or frankfurters, reducing your saturated fat content, such as those fats from meat sources or lard or butter, and your refined carbohydrate intake, so cakes, biscuits and sugar, and that there's no evidence for specific anti-cancer diets. It's just best to follow a healthy, balanced diet. Monitoring your weight and aiming for a healthy BMI by maintaining a calorie deficit and increasing your activity if you want to lose weight, and being more active every day, but most importantly, enjoying your food. These are some useful resources that will help you to continue along your healthy eating journey, and that's everything from me.